In this presentation, we will talk about the caries progression procedure. Since the first kiss your mother gave to you, you were infected by the cariogenic bacteria, which are the Streptococcus mutans and Lactobacilli. But luckily, these bacteria, let's say they were still not active or latent until the eruption of the first primary teeth you have. And that is because something that we have studied in microbiology called tissuetropism. Tissuetropism means that a specific type of microorganisms would love to proliferate and grow in a specific type of tissues or cells, exactly like the hepatitis viruses that would love to grow and proliferate in the hepatic tissues and cells. The same is exactly here for the cariogenic bacteria, which are the Streptococcus mutans and Lactobacilli, that have a tissue tropism trait for the two structure tissues and cells. As we said in the previous video, the sugar plus the cariogenic bacteria will lead to the formation of acids, and these acids will lead to the demineralization of the enamel, and the demineralization of enamel is exactly like the picture that you see when you acid etch the enamel before doing the composite restoration. This is the demineralization procedure. The same as that procedure, when we do the acid etching procedure, the acids that are produced by the bacteria is occurring before the caries lesion happens, and that will lead to the formation of something called incipient caries. These guys look at the cervical part of the canine and the first premolar. You can see this white lesion. This is the incipient carious lesion, that is demineralized enamel. This is the first beginning of the carious procedure, that if we left it without remineralization by putting fluoride foams, gels, or rinses, etc., these will progress and further weakening of the tooth structure will happen, and then there will be a fracture in that tooth structure, and then there will be a cavity that will lead us to the transmission from the incipient caries to the clinical caries. This is the clinical caries and cavity. In general, that was the summary for the progression procedure of the caries lesion that we can diagnose by using the three steps of the diagnosis procedure, which are the history taking, clinical examination, and the use of the diagnostic aids. Thank you for improving yourself. Always try to know, spread knowledge, and construct the world. Be kind to one another, and that is for the greatest benefit to the humankind.